Well, 40 countries have pledged to support India as it struggles under the weight of COVID-19. The country is set to receive 550 oxygen-generating plants, 4,000 oxygen concentrators and 10,000 cylinders, while 17 cryogenic oxygen tankers are also coming in the next few days. It will also receive hundreds of thousands of vaccine doses. India has the second highest number of coronavirus cases in the world at more than 18 million, while more than 200,000 have died from the virus. Joining me live is Felicity Butler-Wever, I should say, UNICEF Australia's Director of International Programs. Thanks very much for your time. We've heard so much of the extent of India's problem right now. What about any plans from the government itself in India? Because so far they seem very averse to any more lockdowns.
Yeah, I can't comment on the decisions of the Indian government. I think everybody is really focused on trying to collaborate, trying to work together and to really interrupt the trajectory that we're seeing of cases. I mean, for UNICEF, we are working with the government. We're working to help strengthen the health system and its response, providing oxygen generators, as you said, to hospitals across the country. And I think, you know, we can't stress enough the importance of coming together at this time, all people from the international communities, governments from around the world, businesses and individual Australians really working to disrupt the trajectory of cases that we're seeing in India right now and avert further tragic loss of lives.
The Australian assistance announced, we often get these numbers and it's, you know, sounds a lot. I think there's 1 million or so masks, N95 masks and so on, and oxygen and all these different things. But how does it compare to what we have? You know, how generous are we really being with what we've offered so far to India?
Look, I think it's too early to say. I mean, people are acting as quickly as they can. We're seeing members of the public already calling in, wanting to help, wanting to donate. The Australian government is obviously working on its own plans to support India. UNICEF is, you know, overnight sending oxygen generation plants, oxygen generators, medical kits, supplies, everything that we can do. We really can't underestimate how big a priority this is at the moment. You know, in the last 24 hours, we are seeing just staggering numbers, you know, 2 deaths per minute on average and 4 new cases every second. So I think, you know, coming at this from every angle we can to try and avert, you know, the humanitarian crisis that is looming.
4 cases a second really brings it home. What about Australians wanting to help? I mean, in parts of the country, money can't buy anything right now, including oxygen. But what is the best way to help at the moment?
Yeah, I mean, UNICEF teams on the ground are deploying senior experts to various parts of the country to kind of assist in the deployment. We are working as hard as we can to get supplies into the country, but we do have critical funding shortages as many agencies do at the moment. And UNICEF Australia has launched an appeal to the public. We're calling on everyday Australians and businesses to give generously and try and at least fill some of the financial gap in trying to get resources into India.
So what about in terms of the population? They're very young, and that was part of the reason they thought maybe that first wave was going to be as bad as it might get. Younger people getting COVID in this second wave. Are many children getting it from what we know?
Yeah, I mean, the new variants are increasingly affecting younger people. But, you know, interestingly, when we focus on cases, you know, children aren't the ones, you know, suffering the worst health impacts, but they certainly are the silent victims of this pandemic. You know, the economic issues that are caused by the lockdowns, you know, 122 million Indian workers lost their livelihoods during the first wave, and that has huge implications for household income, for you know, driving up child poverty and malnutrition. We're seeing millions of children out of school, and the digital divide in India means that, you know, millions of children are going without education, and this will have lifelong implications for them. So we need to remember on both hands, how do we address this immediate and really severe health crisis, but also consider what are the implications for children and young people.
Felicity, all the best, and Australians who can afford to give generously, of course. Thank you.
Great, thank you.